Good afternoon, everyone. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At the moment, all participants are in a listen-only mode. For those that are connected by telephone and require operator assistance during the call, please press *0. For those online that require assistance, please use the chat box on your screen. I would like to now hand the meeting over to your host, Jessica Hodge, Improvement Lead at the Canadian Foundation for Healthcare Improvement. Please go ahead.
Good day, everyone, and welcome to today's webinar. I'm Jessica Hodge, and I'm your host for today's webinar, which is the 6th webinar in CFHI's new discussion series, Community Dementia Care and Support, Innovations Supporting People Living with Dementia and Care Partners Closer to Home. We are pleased to offer French simultaneous interpretation on today's webinar. If you would like to see and hear the presentation in French today and you have not yet been transferred, you can please let us know in the chat box on the bottom right of the screen. Once you have been transferred, you will need to shut down your computer speakers and dial the number on the screen. We also invite you to share your questions and comments at any point using our chat box in either English or French. We will reserve verbal discussion of comments and questions to the end of the webinar, but encourage all of you to respond to comments and answer any questions in the chat as you wish as we go along. Also, a note that we will summarize the chat questions and comments after the webinar and translate to both official languages for sharing in a post-webinar synopsis. The post-webinar email will also include links to the recording of today's webinar. Our participants for today include representatives from across Canada. We are joined by representatives from regional health authorities, universities, Alzheimer's societies, research centers, Dementia Advocacy Canada, ministries, the Canadian Agency for Drugs and Technologies in Health, Canadian Institute of Health Research, Health Canada, Public Health Agency of Canada, community support organizations, dementia care organizations, retirement and long-term care homes, Center for Aging and Brain Health Innovation, Agewell, the Canadian Frailty Network, the Canadian Medical Association, the Royal College of Family Physicians, and government health departments across Canada. Before we go further, I want to begin this webinar by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that I am hosting this webinar from Perth, Ontario, which is the traditional territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, St. Lawrence Iroquois peoples. This territory is covered by the Upper Canada Treaties. I encourage you all to share in the chat box the territory and land you are joining us from today. Our CFHI team involved in creating and producing this webinar series includes Neil Dreimer, Lindsay Yarrow, Emily Lalonde, and myself, Jessica Hodge. My colleagues Sheena, Kelly, and Isabel are behind the scenes producing the webinar. Our presenters today are Arlene Estelle, Faria Mustafa, and Miloe Young. I will now turn it over to each of our presenters to introduce themselves. Arlene, thanks for being here. Over to you to introduce yourself.
Hi, thanks so much, Jessica. Hi, everybody. My name is Dr. Arlene Estelle. I'm a psychologist and I'm a leader of the Dementia Aging Technology Engagement Lab. And I'm delighted to be here with this in this great webinar.
Thank you, Arlene. And Mimi, would you please introduce yourself next?
I'm Miloe Young, and I'm the chair of the board of directors of Agewell, as well as former CEO of the Alzheimer's Society and currently senior fellow at the Institute of Health Policy Management Evaluation at the University of Toronto.
Thank you, Mimi. And Faria, over to you to introduce yourself.
Thanks, Jessica. Hi, everyone. My name is Faria Mustafa Harris. I am the group product manager at Intralight Labs. I oversee Intralight's product strategy and development in senior care and healthcare. And I have a background in cognitive neuroscience, software development, and natural language processing. Happy to be here today.
Thank you. We also have our session moderators. Ron Boleno and Mary Beth Whiten, who will lend their expert perspectives to the information presented and to the comments and questions you enter in the chat. Mary Beth, over to you to introduce yourself.
Thank you. My name is Mary Beth Whiten, and I'm living in Southampton, Ontario. I have a diagnosis received in 2012 with probable frontotemporal dementia, and I got that at the age of 45. And that took me about 2 years to receive this diagnosis. I am the co-chair of Dementia Advocacy Canada, and my work crosses many initiatives, including membership on the Ministerial Advisory Board on Dementia, established by the Federal Health Minister. And I'm on lots of different projects and advisory teams. Thank you.
Thank you, Mary Beth. And Ron, over to you for your introduction.
Hi, everyone. I'm Ron Boleno. I was a caregiver / care partner to a father that had Alzheimer's for over 10 years, and he peacefully passed away back in 2018. I am the co-chair of Agewell's Older Adult and Caregiver Advisory Committee. I am a member of Dementia Advocacy Canada as well. Another group I'm also with is CABI, the Center for Aging and Brain Health Innovation, plus numerous other groups and projects that I'm involved with, just like Mary Beth here. And it's a pleasure to have everyone on the call today.
Thank you, Ron, and thank you to all of our speakers and moderators for being here with us today. As for the objectives for today's webinar, we'd like to provide an overview of CFHI's Community Dementia Care and Support webinar discussion series, broaden awareness and discuss 2 innovations that can help improve early diagnosis and post-diagnostic care and supports in the community, and those 2 innovations are Intralight Labs and DaytoDay. And these innovations have funding from Agewell, so we'll also be hearing about Agewell today. And finally, facilitate a discussion around the potential spread of innovations to improve care and supports in the community for people living with dementia and care partners. CFHI is a not-for-profit organization with a mission to collaborate with partners to identify and spread proven innovations to improve healthcare closer to home and community in areas of shared provincial, territorial, and federal priority. The impact of our work is lasting improvement in patient, family, and caregiver experience and health, work life of providers, and value for money. We believe in the collective power for change, so partnering with others where we can add value is central to our work and vision. Our Community Dementia Discussion Series will broaden awareness and discuss innovations that aim to improve timely diagnosis of dementia in primary care and post-diagnostic supports, including coordination and navigation. To find more information about the topics and webinar dates, you can visit our webpage on the CFHI website. If you know someone who would like to attend this webinar, please send them the link to register to receive the information. If you know about an innovation that could be spread across Canada that improves timely compassionate dementia diagnosis in primary care or coordination and navigation of post-diagnostic care and supports that would work in the COVID-19 context, please email us at the email provided on the screen to let us know. You can also email us at the email provided on the screen if you would like to receive a package to help us promote this webinar discussion series through your website or through social media. For your consideration today and throughout the series, what promising innovations exist that could be spread across Canada, including in the COVID-19 context? What is the feasibility of your organization and/or community to implement and spread the innovations? Where can CFHI add value to support a multi-jurisdictional approach to spreading these innovations? And what are the partnership opportunities to help spread innovations to improve community dementia care and support? I would now like to hand it over and ask a couple of questions to Ron and Mary Beth. Mary Beth, what do you want healthcare providers to share with you to support compassionate diagnosis?
Thank you for that question. Compassion towards people with dementia, it's often suboptimal, which can impact negatively on the clinical outcomes and care. Compassion is of particular importance in the delivery of good quality care for people with dementia. And I'd like respect, including recognizing me as separate to and more than the dementia. I want my healthcare providers to maintain my dignity and treat me with honesty, patience, and hope. And that's a very big one. This requires a clear strategy involving a multidisciplinary team to support me to live well with dementia. Thank you.
Thank you for sharing, Mary Beth. Ron, I'd now like to ask you a question. When could a virtual solution work to support compassionate diagnosis and access to information and supports post-diagnosis?
Thanks, there, Jessica. So as I mentioned, as a past caregiver to a father that had dementia, I also supported my mom, who also was a care partner. And the use of an innovation or a technology as a tool, like a nail and a hammer, like the power of a pen to communicate, like our plumbing system, providing water, which I always compare to the internet, that provides resources, education, and connection. The importance of tools, especially for care partners for someone with dementia, is vital in increasing our daily success and reducing the extremes of those moments when we have failures in our lives. Community actually has become smaller in the virtual world. You don't need to just get support regionally from a local society or organization. You can get it from anywhere around the world if you do have access to these tools. To answer the question, when could a virtual solution work to support compassionate diagnosis and access to information and support post-diagnosis, my answer is all the time. But it's not the only tools and methods to use that I'm going to share here. It's only one way. Virtual solutions are simply tools to help get something done, such as a diagnosis, which can and should always be done with compassion, in my opinion. The ability to access information, access supports, post-diagnosis can be done at any time of the day, 24 hours, not just during 9 a.m. to 5 p.m. But it can also happen at 3 a.m. when a care partner is unable to sleep, worrying about what's next and how they can move forward. So timely information, ideally sooner than much later, is important. And lastly, many individuals learn through painful experiences, whereas they easily could have learned virtually, whether that's in a peer support group or through technologies like what you'll be hearing today. So again, my answer is all the time.
Great. Thank you for that, Ron and Mary Beth, for your reflections. I'd like to now turn it over to Mimi, who's going to present on Agewell today. Mimi, over to you.
Thank you very much, and good morning and good afternoon, everyone. As the chair of the board of directors of Agewell, Canada's Technology and Aging Network, I'm really pleased to offer you a brief overview of Agewell. Next. For context, I want to share with you a recent Agewell poll that was conducted by Environics Research, which showed the resiliency of older adults and how COVID-19 has significantly increased their use of many technologies. 23% of older adults use video calling on their cell phones. This is twice as many as was in 2019 when we did our other research with Environics. 6 in 10 of whom report increased use during COVID. Sorry. Overall, and to say that many were using the technology through social media, online shopping for essential items, and online streaming. Overall, 66% of Canadians aged 55 plus believe technological advances can help to lessen the impact of COVID on daily life. Finally, 76% of Canadians aged 50 and plus are confident using current technology, and 67% are willing to pay out of pocket for technology that allows them to stay at home as they age. Next slide, thank you. Agewell Vision is that Canada's leadership in technology and aging benefits the world. The mission is to continue developing a community of researchers, older adults, caregivers, partners, and future leaders with the goal of accelerating the delivery of technology-based solutions that make a meaningful difference in the lives of Canadians. Next. Let me give you an idea about our accomplishments in just 5 years. Agewell has an impressive track record with over 760 trainees and 250 researchers across 43 universities and research centers in Canada. We have over 420 partners across multiple sectors. We also have 4 innovation hubs, one of which is focused on policy, and we regularly engage with our municipal, provincial, territorial, and federal governments to inform policy initiatives like the National Dementia Strategy. Agewell has 118 solutions with technologies spanning from physical and cognitive assessment apps to smart home sensors and assistive devices all the way to socially assisted robots. You will learn about these two of these technologies today from Faria and Arlene. Most importantly, Agewell has close to 5,000 older adults and caregivers engaged in our network, from the project to the advisory level. And I'm so pleased to see Ron here today and his contributions to the older adult group. And of course, Mary Beth's perspective is also so important for us to listen to. Next slide. So Agewell's plan for the next 3 years is to build off our challenge area framework. We identified 8 challenge areas following a comprehensive review of policy priorities relating to seniors across governments in Canada and internationally. These priorities were validated with research, government, nonprofit, and industry stakeholders, and with, of course, and especially older adults and caregivers who emphasize the need for the challenge area number 4 on cognitive health and dementia. Last slide, please. I want to say thank you very much for the opportunity to tell you about Agewell today. I invite you to visit Agewell's website or contact us to learn more and get involved. Thank you very much.
Thank you, Mimi, for that great presentation about the great work that Agewell is doing. I would now like to hand it over to Faria to provide a presentation on Intralight Labs. Faria, over to you.
Thanks, Jessica. And thanks, everyone, for the wonderful introduction. It's great to be here today. And today I wanted to talk about how our speech and AI technology is helping improve the quality of care for seniors with various conditions. Next slide. Thank you. I'll start off with an introduction to Intralight Labs. So our company was founded in 2015 by researchers from the University of Toronto. Our team members are experts in artificial intelligence, computational linguistics, cognitive neuroscience, and psychiatry. Next. Thanks. Our speech and AI-based assessment can be administered by anyone with minimal training. The assessment is, next. The assessment is comparable to standard cognitive tests, such as the MMSE or MOCA that GPs use. Our assessment is less time-consuming. For example, it would take a few minutes to complete our assessment, whereas standard assessments take between 12 to 30 minutes. Also, our assessment is more objective and sensitive to subtle changes in cognitive and mental health function, and we validated that through numerous academic and studies with partners in institutions across North America and Europe. Next. So what does our technology do? How are we able to measure cognitive impairment and monitor patients with dementia? We can analyze just a few minutes, as little as 2 minutes of speech from any sources. It could be through our tablet-based assessment app that we've created, or it could be from other sources, such as telephone recording from a telehealth service. And from that speech, we're able to extract over 500 language and voice markers. These markers, along with their transformations through machine learning, are sensitive to changes in cognitive and mental health function across a number of diseases that you can pick up through speech and language. So for dementia, here I have some symptoms that you could pick up. For example, pausing a lot while searching for words could be an indication of early memory problems in someone with mild cognitive impairment. Someone with incoherent speech could be, for example, be switching from one topic to another, completely unrelated topic between sentences. This is a symptom that would be picked up in more advanced stages of dementia. Also, speaking slower could be indicative of certain types of dementia where producing words is difficult, or it could be a mood symptom and negativity, just using more negative words when you describe something or talk about something could again be an indication of depression, which is so often comorbid with dementia. Not only are we able to pick up symptoms that characterize dementia and associated comorbidities through speech and language, our machine learning models can predict who is healthy and who might have Alzheimer's disease with up to 90% accuracy, actually above 90% accuracy now. We don't diagnose patients because we're not physicians, but this is just an example of how the technology can be sensitive in picking up issues through speech. So where is our technology being used? We've been, in the last 5 years, we've been working with 5 out of the 10 major life science companies, such as Johnson & Johnson, as well as Elector, and institutions like Harvard University and Baycrest, to inform clinicians and scientists about speech and language changes through a progression of various diseases, including Alzheimer's disease, other types of dementia, such as frontotemporal lobar dementia, depression, etc. So imagine in these situations what happens is seniors or participants with various diseases will participate in a study where they are using Intralight's assessment app, for example, once a month for a period of 12 months, let's say, or a few months. And in parallel, they're receiving therapy, which could be a drug or some other therapy. During this time, clinicians and scientists can monitor who is developing early symptoms, if they are studying populations who were presumed healthy. And when they're monitoring individuals with a diagnosis such as dementia, they can detect whether disease is getting worse. And if the population is receiving therapy, they can identify, using our tool, who is responding to therapy. And as you can imagine, all of this is helping scientists and clinicians around the world develop therapies that are more effective and can be effective for certain patient populations. Now, as you all know, cognitive or mental health issues affect health overall. Even those with mild cognitive or mental health problems are more likely to miss doctor's appointments, mismanage medications, have higher hospital admissions and readmissions, perhaps because they're mismanaging their treatments for diabetes, for example, or perhaps because with cognitive issues, they're at higher risk of falling and they fall and are hospitalized. And needless to say, they may, as diseases progress, need more assistance with daily activities. So, we are now trying to understand how our tool can be used to effectively determine who's at risk of even missing, something as simple as the doctor's appointment, who needs additional care and when. So we're partnering with a number of senior care homes in Canada and the U.S. Examples include VHA Home Healthcare, the Springs Living, Amica, the American House, where seniors who live in their own homes and receive home health care, or those who are in retirement facilities, will take the Intralight assessment once every month or once every 3 months. In this, some of you had previously mentioned remote assessments and multidisciplinary care teams. So that is what we're trying to work with here. There's the option of using our tablet app where the assessment could be administered by a family caregiver to do simple tasks such as describing a picture. Or we can do remote assessments, which are increasingly important in this period, such as telehealth services, where a nurse calls in to check on a patient, and through speech recordings, we're able to provide reports on their cognitive and mental health function to their multidisciplinary care team, which can include nurses, PSWs, loved ones, and of course GPs. Our reports can help the care team identify cognitive or mental health symptoms earlier and act on interventions, which could be as simple as involving the family more if someone's in a retirement facility, and encouraging them to engage in more social activities and exercising if, for example, they're displaying early symptoms of depression or cognitive issues. Also, the reports we provide can be used to consult, can be used and appended for a GP to review and justify further assessments in order to understand if someone has a diagnosis such as mild cognitive impairment or dementia. And in individuals who do have a diagnosis, then alter their treatment plan based on disease progression or maintain it if nothing has changed. The one other thing that we can do is if someone has no diagnosis and the physician is noticing some cognitive symptoms, they can then evaluate if this is a side effect of medications. As you know, some medications manifest in mild cognitive symptoms. And of course, with all of this information and monitoring remotely through a routine basis and virtually sort of connecting the care team, we were hoping that we'd be able to determine if and when seniors need additional services or support from their family. We are running these product trials in North America in 2021. And at the moment, we support our tool in English, but we plan to provide support in French, Spanish, and German next year. Thank you so much for your time. I'm happy to address any questions you have down the line.
Thank you, Faria. We would now like to ask you to answer a couple of questions about Intralight Labs. So we'll pull up a couple of polls. Prior to this webinar, were you aware of Intralight Labs? Yes or no? And I know more about Intralight Labs than I did before participating in this webinar on a 5-point scale: strongly agree, agree, neutral, disagree, and strongly disagree. I invite you to type any questions you have about Intralight Labs into the chat box, and we will address them in the Q&A portion of our webinar after our next presentation. Thank you for filling out the poll. We will close those now and move along to our next presentation. I would now like to hand it over to Arlene for the DaytoDay presentation. Arlene, over to you.
Hi. Okay, so I'm delighted to follow on from Faria's presentation. DaytoDay is I guess, a slightly different approach, and the clue is in the name. You'll also tell that I'm British, so when we say it, it's DaytoDay, and there's sort of a pun there because the intention is that this software will support you in your from day to day. I have to keep explaining it though in North America, so we may someday have to change the name. But the idea is that this is to support self-management, and that's an area that's had very little attention when we think about dementia or mild cognitive impairment. You can see from this first slide that DaytoDay is something that has been supported by both Agewell and CABI, which was also mentioned earlier. And I should say that I am one of the challenge area thought leaders in terms of staying connected, which is part of Agewell. And one of the key things here is to think about what happens after someone has a diagnosis. So in creating DaytoDay, we were thinking very much about other conditions which are common in later life. For example, type 2 diabetes, where people are given a set of tools to help them live with this condition. So they go home, they may have somebody, a phone line to call, they may take their blood sugars and send them off every day. They may be offered lifestyle classes to attend, but they're generally given some tools to equip them to self-manage their condition. But we tend to have overlooked that when people receive a diagnosis of dementia or MCI. And so that's what DaytoDay was established to do. And you can see it's a collaborative project. And I'm going to quickly just introduce you to the main elements and how we created it and what we've been doing with it. So one of the key aspects of DaytoDay is that it was co-designed, and that means that we worked with people who are currently living with MCI or early dementia, and also some family caregivers, not necessarily of the individuals with MCI or dementia. We also had some family caregivers whose partners were not participating. But that means that when we were thinking about what this should look like, what the screens would look like, this is an application that is used on a device, either a smartphone as in this image or on a tablet. And we wanted to make it as intuitive and accessible and as easy to use, so it didn't matter if you had prior experience with these devices or not. And our aim was to allow people to keep track of how they're doing over time. This was a message we kept hearing from people. They're interested to know, once they go home and they have this diagnosis, well, how am I doing? They want to know, are they okay? Are they having any problems? If changes that they experience, are these things to be worried about? Are they just usual? Are they even unrelated to their dementia or MCI? And we focused on 4 areas: cognition, which obviously is a key component of these conditions, their mood, because clearly living with these conditions can affect your mood, people's diets, because we know that that can be a big concern if people change their eating patterns, and also how physically active people are. And so DaytoDay was created with all these interested parties to be able to track over time, so use it every day, but also to facilitate detection of these changes. So if there were things that people should be concerned about, and also provide support so people can live as well as possible with a cognitive impairment. And that includes family members who may also be supporting them, that they would have access to this sort of information. So it takes the form of an application, and that's because it was actually based on a previously developed tool called NANA, which was the Novel Assessment of Nutrition and Aging. And that's where we developed these 4 modules of cognition, nutrition, mood, and activity. And that was also co-created with over 400 older adults who wanted something that they could use every day. And it was during the course of that people with some cognitive impairment said, we want something that's really tailored for us in terms of the look and the features, and that's where DaytoDay came from. So it's a mobile app, and it has this, I'm not sure what's happening now. I'm trying to click and nothing is happening. Oh, there we go. It has this logo that represents it, and it has a number of features, including reminders, so people can schedule reminders of things that are coming up. It also has a speaking clock, so you can always find out what the time is. And it has these 4 modules that you are encouraged to fill in at least once a day. So one of them is a cognition, very simple. It's not a test. It's not called a test. It's a very simple game called the shopping list game. And it's validated against gold standard measures that are used in cognitive assessments, but this is a version that we've tested and shown to be very sensitive to change over time. There's also a dietary screen where you can enter food, and it's done through just selecting items, and it gives you a record of what you have eaten and also a snapshot of your meal, so you can quickly look over the day or the week or the month to see what meals you had and when you ate them. There is also a mood measure, which again you can see is very simple. It's just a slider here that you can move backwards and forwards. It takes a few minutes to complete, and you can complete this every day to keep track of how you're feeling. And again, you can choose the time of day that you want to use it. And then there is a physical activity one, which is just, again, some questions. These have all been validated against gold standard measures, and you can keep a track of how much activity you've been doing, especially important now we're living with COVID, and people are encouraged to get out at least once a day. And one of the things that this does is collect some statistics. So this is the idea of being able to keep track of how you're doing. So you can see how you're doing over time. So we have an opportunity here. You can click this, and it takes you to see a page with your dashboard. So for instance, any messages that you've had from the clinical team, which I will explain about, and also the statistics of your daily activities. So it could be your cognition. You can click on and you can see your scores, you can see what you've eaten, you can track your mood, and you can look back and say, oh, I wonder why my mood was a bit lower that day. And you can see if there was any particular reason on that day that you were feeling a bit down, or if you, for instance, had less activity. And also we can look for patterns over time. So if there's a change over several days, then you might want to investigate further. So I mentioned the clinicians. So we've worked very closely with memory services teams, so clinics that are doing cognitive assessments and diagnostic assessments. And we worked with them to try to create a portal that had very easily accessible visual information, so they could very easily see patterns for the clients they're supporting and what features they wanted. So they are highlighted here, and we based this on, again, a number of co-creation sessions with them, testing out different portals and displays and the things that they wanted to see. So there's the messaging, there is the name of the client that they are linked to, and the person with dementia or MCI has to agree to this. They have to say they want to share it with the clinicians, and they can get messaging or alerts on any of these areas, and they can look at them side by side and over time, so that if they notice for instance, that someone's mood is down, they can also check what sort of food were they eating, what was their cognition like, and were they taking any activity, and they can see if it's just like one day where there's a change, or is it a pattern. They also receive alerts, and they can then determine whether to follow up with that by a phone call or a visit, or a video conference, I guess, today, and how that can, how best to support the individual. So this is really a tool both for the person themselves to live with their diagnosis once they go home, and also it can link them with the local team who can have access to brand new information which has never been available before, basically as someone lives with this from day to day. So one of the aims when we were initially creating this, and it's still there, is to reduce those unplanned emergency room visits and hospital admissions, which we know are very hard for people to recover from when they have dementia or MCI. They have more alternate level of care days, they have longer admissions, and they have a reduced chance of going home. So the idea is if you can spot the early signs of changes, you can intervene more sooner. And we know from the work that we're doing currently with the clinical teams that has been a really useful feature. They can prioritize who to check in with and look at those patterns and see the changes emerging. And similarly for family care partners who maybe don't live in the same house and can check in and see that mum or dad is eating, is going out, is responding to messages. And if they're not, then again to follow up and to to check in if there are some problems. So these are our contact details. We do have a website, although it's under improvement at the moment. But basically, this is really a tool for individuals and their families to provide them some information and ongoing support and help to signpost them towards when they need to get further help. So thank you very much for the opportunity to share it with you.
All right, thank you, Arlene. We now have a couple of questions to ask you about DaytoDay. So we're going to pull up a couple of polls. Prior to this webinar, were you aware of DaytoDay? Yes or no? And I know more about DaytoDay than I did before participating in this webinar on a 5-point scale: strongly agree, agree, neutral, disagree, strongly disagree. If you have any questions for Arlene, please type them in the chat box in either of the 2 official languages, and we'll get to them in just a moment. Thank you for answering the poll. Keep your comments and questions coming, and what we don't get to today, we will answer and summarize in a post-webinar synopsis you will get within a few weeks to allow for translation. So we'll now close the poll and come back to our presentation, where I will turn it over to Mary Beth and Ron to share some reflections on what we have heard today. Mary Beth, would you like to go first?
Sure. Yes, thank you. Wow. It's quite a presentation, I think, that we just saw today. And it's really welcoming to see the focus on collecting data, big data, small data, whatever it is, data. And that helps to provide the necessary information on the changes of a person with dementia. These innovations, I think, expedite the diagnosis process, which is very much needed to help people with dementia move on with their life. It's not just about the diagnosis, it's about what happens afterwards. Typically, this lead up can be up to 2 years, which is in my case. Now, although dementia is a terminal disease, we should manage dementia as a chronic progressive disease. So in the same way that we do for a stroke or a brain injury that happens. Dementia must be seen not only as a condition bringing with it acquired cognitive disabilities, but one that involves the basic human right of being provided with rehabilitation and proactive disability assessment support at that time of diagnosis. Both innovations discussed are examples of tools to help push forward the human rights model of disability in Canada and away from the medical model that we still use very much so. The innovations provided the ability for people with dementia to remain citizens, which is very much opposite to what happens in many cases, which is we're told to go home, get our affairs in order, and prepare to die. And that is very prevalent. Both innovations provide the ability to receive a timely diagnosis and for rehabilitation, which is actually, it's called an article, Article 26, on the Convention on the Rights of People with Disability. In addition, it provides people with dementia to be active in their own health care, which is so important. Dementia needs a new model of pre- and post-diagnostic support and care, supporting the acquired disabilities that dementia brings. Cognitive disability, as we know, is usually responded in a reactive manner. So the innovation DaytoDay, that's co-designed, which is awesome, and not just awesome, but what we should expect from data applications, uses the data captured on a daily basis about the cognitive function, the mood, the diet, and physical activity. And those 4 areas are critical for people with dementia to remain independent for longer. The ability to look at that data quickly and objectively, it really provides the support that is needed. And then Winter Labs, it measures that cognition via hundreds of vocal biomarkers in speech and language against, the speaking of the ability, and it speaks to the ability of rehabilitation, which is the right of persons with dementia. So I think this collection of statistics will give a healthcare team really that necessary data to push for better support. So today's innovations are really helping to set up Canada to take the next steps, moving from a medical model of care to a human rights model of care. And, I'm really excited to see what happens. So over to you, Ron.
Thanks, Maribeth, and appreciate that there. Also, I just want to say thank you to Faria and Arlene for presenting some of the technologies, innovations that is happening within the Agewell community. I'm going to just first start with kind of the voice technology piece. And I want to say that voice technology is being used more now every day and has increased immensely in simply the past, the past 1 to 3 years. We're using speech and voice technology and tools such as our phones, with Siri. Many of us now have home devices like a Google Home and Amazon Alexa. I had to turn my Alexa off right now because every time I say that, it activates in a presentation. But I do want to kind of put aside not necessarily just what the tools do. For example, we also have to talk, be aware of some of the other concerns. For example, technologies, we have to be aware of privacy and ethical concerns of technology with some of these tools that might, let's say, listen in. But I'm not going to go too deep into that now, just something that I want everyone to be aware of, and that's a conversation that can take hours. The ability of, for example, for Winterlight's technology was shared in helping assess cognitive and mental health. And any tool that can do this to speed up assessments and provide data during someone's journey is definitely a benefit. It's definitely something that is important that we need to get better at. What I'd like to actually address just in my time here is that some of these technologies with Winterlight and DaytoDay that Faria and Arlene talked about, plus the many other virtual age tech tools that innovators within Agewell and across Canada are developing, is that they can help reduce the digital divide. That's what I wanted to bring up, the digital divide across the world, especially in regions where healthcare systems may be weaker. We're quite fortunate here in Canada, but tools that are made here in Canada, such as these ones, can go worldwide. Healthcare is definitely not fair around the world, and virtual tools, if they can be accessed, can also help those communities that may not have local expertise and tools. Many of you know that's probably listening in on something we call social determinants of health. But there's also something that we'll be talking a lot about in the future, is the digital determinants of health. I'm not going to go into that now, but having access to digital technologies is required moving forward in our future, moving forward now. So that's just something to be aware of. As I finish off here, virtual care and age tech should not just be used as the only answer when it comes to care. The best solutions out there are when there is a combination of other supports, such as low-tech solutions, human interaction, peer and community supports, policy improvements, plus a combination of other creative strategies to tackle all the challenges related to dementia. So for everyone working in this space, I'm just going to ask that we all make sure we are always considering how to combine these tools with other combined solutions to provide the best impact for the person living with dementia and the care team. Okay. Thanks. So back to you there, Jessica.
Great. Thank you, Ron and Mary Beth, for your great reflections. So we did receive a couple of questions through the chat box. So Arlene, a question for you. Can DaytoDay use data from a Fitbit or similar device?
It could. It doesn't at the moment, and that was because when we were developing and doing the co-creation, we wanted to limit to one device. We didn't want to have to put demands on people to keep two devices charged and and use them all the time. So we went with one, but it's certainly something we're considering for the future, given that more people are now using these anyway.
Great, thank you. Is the app currently available for use?
Well, I'll say yes. Yes and no. Yes, it is from us. So if anybody is interested, would like to use it, to try, they need to contact us currently. The reason is that the way it's been used at the moment through links with a memory clinic, it's not just available to download from the App Store, but we're happy, we're currently making, letting it, launching it with people. Anybody who wants to have it can just contact us, sure.
Great, thank you. Faria, what is the cost for an assessment through Intralight Labs software?
Thanks, Jessica. Great question. So it really depends on where it's being used. Of course, costs differ in a research setting versus primary care. I'm going to assume primary care and say it's a few dollars per month. It's a monthly subscription that we're aiming for through our trials, so $1 to $3 per month per person for continuous assessments. And we could do more frequent assessments than just once per month.
Okay, great. And one more question, Faria. How are diagnostic methods being pushed out to primary care physicians and geriatricians?
Right. Great question again. I might have mentioned that we're partnering with care partners just more recently. So this solution is not completely productionalized yet. We have our solutions, both our software backend solutions are HIPAA compliant, compliant with the regulations. We can provide encrypted emails or through our API push results to the EHR system for the hospital or senior care living.
Great, thank you. And a couple more questions for Arlene. Is DaytoDay app available in other languages?
It's current, so it has, I should say first of all, it has very little language in it. It's very visually based. So the translation is very minimal. It's currently, the French version is just being finalized, but it's very straightforward to translate to other languages. The bigger challenge is more to do with diet, but we're slightly changing the dietary intake method to make it even simpler. So the key element of that is a photograph. It's just generating the label. Yeah, it's a very minimal language application anyway. So it's quite straightforward for translation.
Thank you. And one more question. Have you tested this app in rural or remote locations with limited bandwidth?
Not completely rural. I mean, some away from big cities for sure. We've done most of the testing in Ontario, in different parts. We've certainly had people who have no Wi-Fi and provided sort of cellular packages, and we found pretty good coverage. But that was more to address the issue of people who were not really previously internet users. So we're very keen to try it out in further flung locations. So if somebody is interested in having a go with that, we're very keen to expand that experience, because we have sort of mainly located it with people who are who are coming through the clinic, so they're within sort of distance of those services, so a bit more better served, I guess.
Okay, and we just got one more question. Do you have traditional foods in the diet portion of the app? So I think maybe even asking the question, how does your app work with dealing
Yeah.
with foods from different cultures?
Yeah, so it's interesting because when we originally created this, I should say it was created in the UK based on a diet from several hundred older adults and their dietary preferences. And then over the years, we've modified that. And then we made a whole new Canadian database. And it has a section for people to enter their own foods. They can either put their favorites if there's meals they eat regularly, but there's also certainly, and obviously in such a diverse community as we are in, there has to be scope for people to report, what it is that they traditionally eat. And that's one of the reasons that we use the visual images so people can select their, both for selecting what they're eating, but also for taking their own photographs. So that's one of the key components. And as I say, everything is designed to be as few steps as possible. So yeah, that's a really important that was a really important consideration to allow people who have different diets to be able to capture what their food is and when they're eating it.
Great, and there was also a request in the chat box for the contact information for both technologies. So Faria and Arlene, could I ask you to just put your contact information in the chat box, and we will also include that contact information in the synopsis that will be sent after the webinar.
Perfect.
And those were all the questions we received today. So like I said, we will summarize the conversation and the questions in the chat box and send out a post-webinar synopsis. I would like to thank Mimi, Arlene, and Faria for their presentations today. I would also like to thank Mary Beth and Ron for their thoughtful reflections and comments. Thank you to our producers, operators, and simultaneous interpreters for their efforts in making this webinar happen. And finally, thank you to all of you for joining us today.